So here is a list of drugs that people can get addicted to and people can abuse. And these drugs are known as central nervous system depressants. So when you think of central nervous system, think of brain. And depressants are things that slow down the brain. So alcohol slows down your brain. Opioids slow down your brain. Nitrous oxide, they kind of calm you, they kind of slow you down. Okay, so these are drugs that are known as depressant because they slow your brain or slow down your body. So the first one we're going to look at is alcohol or ethyl alcohol. And this is the #1 problem in North America. Alcoholism is a very common disease that people have. So let's look at what happens when someone takes alcohol. Well, all these things can happen. Impairment of judgment, right? They say you can't drive when you're drinking alcohol because you're not able, because of the impairment of judgment. You're not able to see the signs. You just don't. You're not able to drive safely. Dilated pupils. Your speech is slurred. You staggered gait, which means that you can't stand up properly. You're slouching, and of course, if you're overdose on alcohol, you could get seizures, coma, or even death, right? You could die. So these are all signs of alcoholism or symptoms that can happen if we drink alcohol. Now, let's say you're addicted to alcohol and now you need to withdraw. So if you have to withdraw, there are stages. Stage 1 is basically a few hours after stopping, you have mild withdrawal symptoms. And this is where you start to feel a little anxious, nauseated. Maybe you have a little bit of tummy pain. Maybe you can't sleep, so insomnia. That's what usually happens in stage 1. Stage 2, so now it's almost 12 to 48 hours after alcohol, so after your last sip of alcohol. And now you have moderate withdrawal symptoms. And this is where you're hallucinating, which means you're seeing things, you're hearing things. You have paranoid behavior. You could start to forget things. And in stage 3, this is usually the worst stage. This is where you would feel very disoriented. You have no idea where you are. You feel very delusional, and you could even have really bad seizures. Typically, what happens is after 5 to 7 days, these withdrawal symptoms go away. But within those first few hours and even up to 5 days, it could be very severe. So it's not easy to quit alcohol. But there are help that's available, which I'll go over in a bit. So if someone wants to withdraw from alcohol or quit alcohol, remember we talked about cross-tolerant, like another drug, another substitute that they can take to help prevent the withdrawal symptoms, like benzodiazepine. This is a good drug that they can take if they're addicted to alcohol, because when they take that, all the withdrawal symptoms such as nausea, abdominal pain, insomnia, sweating, all that will go away. Sometimes withdrawal symptoms are known as delirium tremens, DTs, because when people go through withdrawal, their body starts shaking a lot, so that this word kind of means shaky movements. You guys all know the effects of alcoholism. They're all listed over here. And as we know, alcoholism is a disease. It's when someone continues to drink. And if you know someone that has alcoholism or that is an alcoholic, these are the symptoms that they usually would have. They're drinking at an inappropriately early time. So first thing in the morning, they usually go and have a drink. They're shaking. If they don't drink, they're going to be shaking. They could black out. So after they drink, they black out. And if someone tells them, that you're drinking too much, they probably are, and they're probably suffering from alcoholism. So how do you treat it? Well, there's this group called an Alcoholics Anonymous group that I'm sure you've heard of. It's a self-help organization, and it's done by recovered alcoholics, and they all give support to other alcoholics who are attempting to recover from alcohol. There are definitely medications that people can take to help with alcohol abuse or alcoholism. So the first medication is called disulfiram, and disulfiram is a great medication because it prevents you from getting addicted to alcohol. This one you guys have heard of before. It's called naltrexone, and this was typically used for opioid, right? When someone has overdosed on opioid, or if they are going through an opioid treatment program, they'll be given this drug. And then here's another drug as well. This is a new drug that actually just came out recently that is used to treat alcoholism. So when you look inside an alcoholic client's mouth, you'll notice that they'll have poor oral hygiene. Their breath will smell of alcohol. They have glossitis, which means their tongue will be red and inflamed. They're slow healing, so if you debride and then they come back later, you'll notice that the gums haven't healed as you would have liked. They could be bleeding quite a bit, and this is pretty big. They could have cancerous lesions because alcohol can cause cancer, oral cancer in the mouth. So you could see some cancerous lesions in the mouth. The next depressant drug that we'll look at, or the next drug that kind of slows and calms you down, is nitrous oxide. And nitrous oxide is found in dental offices. Usually when they want to calm someone down, they'll give nitrous oxide and then they'll go ahead with the treatment. It is unfortunate, but dentists, hygienists, and assistants do abuse it or have abused it in the past. We have seen in the news there have been cases where dentists would, once they close, the dentist would go take some nitrous oxide, and the next day, the hygienist or the assistant would find the dentist dead in the chair because they have overdosed in nitrous oxide, because it can be fatal. Food service workers, the reason why food service workers can abuse nitrous oxide is because think about the aerosol in the canned whipping cream product. So they could inhale that canned whipping cream product and get addicted to nitrous oxide that way. So that's why it says food service workers are also at risk. So what happens if someone is abusing nitrous oxide? They are dependent on it completely. They need it to function. And usually what they do is they inhale it, and then they get that high, get that good feeling for 30 seconds. And then after 30 seconds, they'll feel that intense good feeling, that euphoria, for 2 to 3 minutes, and that's what they like. And what happens is they get that tingling or warm feeling around their face, and they like that. Sometimes, however, it can cause illusions, so they can see things, hear things that's not there. Their speech will not be good, and they won't be able to walk properly. They're stumbling. So these are all adverse reactions. These are all bad things that can happen if you take nitrous oxide. So you feel dizzy, headache, heart rate can go crazy, you could faint, and really you could even die. As I said, there are some dentists that have unfortunately died because they overdosed on nitrous oxide. And of course, it can also cause infertility, right? So this is not only for females, but this is also for males. Okay, opioid. This is another type of drug that's known as a central nervous system depressant, or that can calm or slow you down. And these are some examples of opioid analgesics. So this analgesic means pain relieving, so opioid for pain. People who do overdose on this have these symptoms. So they have fixed pinpoint pupils. They can fall asleep right away. They're breathing, depressed respiration, so they have shallow breathing. They could feel very drowsy. They could get into coma as a worst case. So people who take opioid, if they stop, the first signs of withdrawal from heroin, for example, is yawning. They could have lacrimations, so runny eyes, runny nose, sweating, and these are the worst symptoms. So they start, have shaking, right? So tremors. They'll be very upset easily. They'll have increased heart rate, increased BP. Lots of things that could happen. These are common withdrawal symptoms actually that happen with opioid use. And then, as we know, naloxone and methadone, those are the two common drugs that are used to help with the overdose. And then there's also other drugs over here, such as phenothiazine and benzodiazepine. So why do we care? What are the dental implications? Well, the dental implications is that if a client comes to you with pain, we're not going to give them an opioid. Dentists are not going to prescribe an opioid. Instead, what they're going to do is they're going to see if they can figure out what's causing the pain. Maybe they can just drain an abscess. Maybe they can just incise or cut that abscess and drain it out, and the pain will be gone. If there is pain, typically what we say is prescribe NSAIDs, not to prescribe any opioid, because there is a good chance that they could get addicted. Most of the time, you'll see clients come to you to shop for opioids. They'll come to you with stories saying that they're in intense pain and they need this medication, this opioid medication. and they'll say they're allergic to all the other types of medications and this is the only medication they can take. So they'll make up some crazy stories just to get the dentist to prescribe them opioids. The reason why it says chronic pain here is if someone is in pain and for a very long period of time, we're not going to give them opioid. Instead, we're going to refer them to the doctor, tell them to get a full, complete work done, like a blood work done, to see why they're having that chronic pain and to treat that pain with the doctor, not necessarily with the dentist. The last type of drug we'll look at is a sedative, hypnotics, and this is basically where a sedative is, so it's a drug that helps calm you, and a hypnotic drug or effect is something that puts you to sleep, like that's over here. So these are a list of drugs that could calm you and induce sleep. And when you take these type of drugs, there's obviously withdrawal symptoms, and so anytime you stop, when you're addicted to a drug, anytime you stop, you will experience these withdrawal symptoms. First ones are usually you can't sleep, you're weak, you have, you could have tremors, sweating, restlessness. One of the common sedative hypnotics is roofies, which you may have heard of, and this is a date rape drug, right? Where someone would slip in the drug inside your drink when you're not looking, and then unfortunately take advantage of you. And I'm sure you guys are all well aware of these, and so that's why whenever you go out drinking, you're very careful and mindful of your drink. So when someone needs to withdraw from this type of drug, it's better that they do it in a hospital setting, because if you withdraw from a drug like one of these that we talked about, it could affect your heart and your breathing in a very bad way. So you kind of want to be monitored. Okay. The next slide, the next video, we're going to look at the opposite, which is central nervous system stimulants. So something that keeps you awake.